Okay, now dopamine receptor agonist. This is a group of compounds which contain bromocriptine, ropinirole, pramipexole, rotigotine, apomorphine. These agents have longer duration of action than levodopa, and they are ineffective who does not respond to levodopa. Apomorphine is available in injectable, and its reverse effects are severely limited. Mostly they cause sedation, hallucination, confusion, nausea, and hypotension, which is usually with these CNS drugs. You can see the list here. Hypotension. Now first we'll have a look at ergot derivative, that is bromocriptine. It is similar to levodopa except that hallucination, confusion, delirium, nausea, and orthostatic hypotension, these are more common. Dyskinesia is less prominent here. And it will cause mental condition to worsen, so it must be given with caution. It is an ergot derivative, so it will cause pulmonary and retroperitoneal fibrosis. Next, apomorphine, pramipexole, ropinirole, and rotigotine. These are non-ergot dopamine agonists used in the treatment for Parkinson's disease. Now, first ropinirole. This is also indicated for RLS, restless leg syndrome. Pramipexole and ropinirole, these are orally active drugs. Apomorphine and rotigotine, these are available in injectable and transdermal patches. Now, apomorphine is used for acute management of hypomobility of phenomena in advanced disease. Rotigotine is OD transdermal patch, and patients which have never taken levodopa, so they will increase the motor deficit. Dopamine agonist can delay the need to use levodopa in early diseases. Pramipexole is mainly excreted in urine. The fluoroquinolone antibiotics and other cytochrome P450 inhibitors will inhibit the metabolism of ropinirole, and dosage adjustment is required. Now you can see here dopamine agonists will delay motor complications and are most commonly initiated before levodopa in patients who have mild disease and at a younger age at onset, because they may delay the need to start levodopa therapy. So at 5 years you can have a look here, the percentage, and the 4 years you can have a look at the percentage. Ropinirole and pramipexole. Now this is a summary table of pharmacokinetic properties for pramipexole, ropinirole, rotigotine, which are dopamine agonist, non-ergot derivatives. So bioavailability is 90%, 55 and 45. Half-life is 8 hours, 6 hours and 7 hours. And metabolism here, it is negligible and it is extensive, so enzyme inhibitors or inducers will affect them. And elimination is mainly through renal. Now the next drug is amantadine. It is an antiviral drug. Okay, it has an anti-Parkinsonism action. It affects on a number of neurotransmitters implicated in Parkinsonism, increasing the release of dopamine and blocking the cholinergic receptors, inhibiting the NMDA type of glutamate receptors. Okay, a number of actions it does. The drug may cause restless agitation, confusion, hallucinations, and it may induce toxic psychosis as well, orthostatic hypotension, urinary retention. And it is efficacious than levodopa, and tolerance may also occur. Now antimuscarinic agents. Next, these are less efficacious than levodopa, and they also play an adjuvant role in the therapy, so they are given in combination. They are benztropine and trihexyphenidyl. They block the cholinergic transmission and produce similar effect to augmentation of dopaminergic transmission, and they adversely affect mood changes, confusion, xerostomia, constipation, visual problems because of muscarinic blockers. They will interfere with GI peristalsis and are contraindicated with glaucoma, prostatic hyperplasia. Now next,